is called as low milk supply when you are feeding your young one. Well, what do you mean by low milk supply? When a mother is nursing the child, it so happens that the mother has small supply or insufficient supply of milk, which is a problem or a condition arising due to many factors. To understand this, we will take a dig at how this happens and how to overcome the challenges that we face when we are breastfeeding a child. Now, in a situation I give you that the birth of the child has taken place in the hospital, and there are doctors, team of nurses, there is lactation consultant, there are relatives, there are other family members who are taking care of the child. Okay. Second thing, what we understand is that the child is being breastfed from the first hour of the birth. So it generally happens that the child is breastfed at the correct time, or probably if there has been a C section or there has been a delay due to something, breastfeeding can still be initiated and the baby can be given colostrum, which is called as the golden milk or the golden liquid. This is very important because it contains a lot of immunity boosters, which helps the child's immunity to grow. Now, this is one thing. Feeding generally takes place at a regular interval of 2 to 2.5 hours, and over here we have to understand that it becomes a demand feed. This means that the child is demanding for milk after a particular time, and the mother feeds the child at the breast. And the mother also understands that the child's requirements grow as per the time is taken care and as per the hours. Now, initially, when we say about feeding, it is very, very small in quantity. I had mentioned in my earlier talks as well. Okay, so it starts with 5 ml to 10 ml, then it goes on by third day, fourth day, it goes on to 15, 20 ml. And by the seventh or the eighth day, is the feeding quantity, as in like the breast milk quantity, goes up to 50 ml for one time, one feed. Okay. Now every mother who nurses her child has a variety of feeding cycles. Now what do you mean by feeding cycle is basically you feed your child on both the breasts at one time, and it could be between 15 minutes, can go up to 20 minutes, it can get extended to 20 45 minutes, and so on. Over here we have to understand that whether the child is taking the feed properly, whether the child is able to latch onto the breast properly, whether the child is able to suck the feed properly. This is very important. But at a given point of time, if the mother is too tired, if the mother is unable to focus on the feeding patterns, we also try and understand that the child is only suckling with a shallow latch, and sometimes the baby moves off the breast very quickly, like just within 5 to 10 minutes the feeding is done and the baby is off the breast. The mother might feel that the baby has had enough food, and then she burps the child. This is the story. But if the milk is in a less quantity, how do we understand that? We have understood that if we hand express on the breast, we understand how much quantity it is coming in. But if the child is again and again asking for feeding, if the child is becoming cranky, if the child is crying, if the child is again demanding for more time feeding, so we understand that he is hungry because there is less amount of milk. So to understand where do the problem comes with low amount of milk is that one reason is the mother is unable to feed the child continuously because even she gets tired. So over there the calorie exertion of the mother is taken care of, like she is not having sufficient amount of food. हमारे जो इंडियन ट्रेडिशंस होते हैं, दे आर सो वेरी डिफरेंट दैट एट अ गिवन पॉइंट ऑफ टाइम कुछ रिस्ट्रिक्शंस आ जाते हैं, कुछ खाने पीने में अवॉइड करना चाहिए, ध्यान देना चाहिए, बट ये दीज ऑल थिंग्स हेल्प इन लोअरिंग द मिल्क प्रोडक्शन क्वांटिटी इन द मदर. माँ पानी कम पीती है, सिजेरियन होने के बाद खाने में रिस्ट्रिक्शंस आते हैं, फ्रूट्स और वेजिटेबल्स नहीं खा सकते हैं, स्पाइसी फूड नहीं खा सकते हैं, नॉनवेज खाना मना है। तो अगर बच्चे को दूध देना है तो माँ कहाँ से प्रोड्यूस करेगी, क्योंकि यही दूध बच्चे के जीवन के लिए सात्विक है और बच्चे के योगदान, बच्चे के बढ़ने के लिए भी योगदान देता है। So we have to understand that if we are putting restriction on the mother, definitely there is going to be low milk supply. Second point of understanding the reason for low milk supply is because of her, if she has had any surgery or if she has less breast tissue. अगर ब्रेस्ट का साइज कम है या इरेगुलर शेप ब्रेस्ट है, कभी कभार ऐसे होता है कि मिल्क प्रोडक्शन पहले से ही कम है, इसीलिए वो एक कारण भी हो सकता है। तो जैसे मैंने पिछले टॉक्स में भी कहा है कि ब्रेस्ट असेसमेंट करवाना बहुत ज़्यादा ज़रूरी है और वो एक गायनेकोलॉजिस्ट ही करवा के आपको हेल्प करेगी, जहाँ पे वो आपको बता पाएगी कि आपका निपल्स बराबर है या नहीं, या आपके ब्रेस्ट का जो ग्रोथ है वो प्रेगनेंसी में बराबर रहा है या नहीं। थर्ड चीज़ जो होती है इसमें लो सप्लाई में, हम लोग को ये पता चलता है कि हमारे हॉर्मोन्स ऊपर नीचे होते हैं। Once we give birth, the hormones which are important are oxytocin, which helps in the production of milk. But at the same time, if the child is nursing at the breast, if the child is, taking milk supply exclusively by breastfeeding, the effect can be seen on the mother's health immediately. But if she is not able to nurse the baby properly, if she is giving formula due to some other reason, then definitely there is going to be low milk supply. Second thing is that if she is into surgery and the baby is not put to breast even 24 hours post surgery, then there is definitely going to be a milk supply which is going to be low, because the hormones over here play a very effective and an important role. It is not that the milk is not going to come, it is the process gets delayed or it gets slowed down because the suckling activity at the breast helps for the good intake of the milk from the mother. So as the suckling of the child starts at the breast, suckling मतलब दूध निकालने की क्षमता बच्चे में जैसे जैसे शुरुआत होती है, उसके कारण माँ का दूध का बनाने की क्षमता बढ़ जाती है। So this is the understanding that we have to have, that the mother is fully equipped to produce good quantity of milk and in good amount. But if due to some reason the supply is getting hampered, it is due to the process in which the mother has got stuck. एक यूजर का क्वेश्चन आया आया है कि सी सेक्शन के बाद ये ऐसा हो सकता है क्या, लाइक कैन दिस हैपन आफ्टर सी सेक्शन इन डील इन हैविंग लो सप्लाई ऑफ मिल्क? Well, yes. After the C-section has happened, what generally takes place is that 24 hours to 48 hours, the mother is trying to adjust herself because of the stitches, because of the pain. She's still in that pain, that she's just given birth and she's trying to adjust with herself with the baby. पर अगर यहाँ पे माँ ने इमीडिएटली ब्रेस्ट फीडिंग नहीं शुरू किया, तो वो फीडिंग को हैम्पर हो सकता है, वो डिले हो सकता है। ऐसा नहीं है कि उनका फीडिंग कम हो जाता है या उनका फीडिंग बंद हो जाता है, ये नहीं है। डिले ज़रूर होगा क्योंकि उन्होंने बच्चे को इमीडिएटली स्किन टू स्किन कॉन्टैक्ट नहीं किया था और इमीडिएटली बच्चे के साथ फीडिंग नहीं किया था, इसके कारण वो डिले हो जाएगा। परंतु अगर यही कोशिश हमने अच्छे से की कि सिजेरियन होने के बाद बच्चे को इमीडिएटली हम लोगों ने चेस्ट पे लगाया है, तो वो मिल्क प्रोडक्शन की क्वांटिटी बढ़ती जाएगी। दूसरा एक सवाल आया है, पूछा गया है कि क्या हम लोगों को जब पीसीओएस रहता है या थायराइड रहता है, उसके कारण भी ये सब चीजें हो सकती है क्या? जी हाँ, ये चीजें हो सकती हैं क्योंकि आप एक मेडिकेशन पे हो, थायराइड की मेडिकेशन हो या पीसीओएस की मेडिकेशन हो, जो आपके हॉर्मोन्स को रेगुलेट करती है. When these hormones are regulated, you have to understand that your milk quality and quantity will not get hampered. But you have to understand that the time difference will be causing such a stress onto you. If you are stressed even after your delivery, then definitely that is going to have a impact onto your organs, and because of which the hormone levels will be lowered and the milk production will also be lowered. So it will be delayed, as I told, but it will not be like your milk production will be suddenly stopped. Okay, so we have to be careful from the very beginning in understanding that why these milk low supply milk issues come. They also, now what I discussed was within the first 1 week of birth, after 1 week of birth. But many, mothers keep telling that after 1.5 months of birth, or maybe after 2 months of birth, they start experiencing low milk supply. Now, sometimes there is a possibility that you are not taking the natural foods, like what we call it as galactogogues, जैसे कि दूध बढ़ाने वाली जो चीज़ें हमारे खाने में होनी चाहिए, जैसे मेथी सीड्स है, गार्लिक है, या हमारा अलसी है, ये जो पदार्थ होते हैं, इससे दूध बनना शुरू हो जाता है। अगर आपने, मैंने जैसे बताया, अगर आपने खाना प्रॉपर्ली नहीं खाया, सो ये चीज़ें आपको मदद नहीं करेंगी दूध बढ़ाने के लिए। So, if you don't have these galactogogues in your regular eating habits, then definitely it is going to hamper the milk production. A mother who is feeding is asked to have more calories, is asked to have a very well balanced diet, which includes fruits and vegetables, good sources of proteins, which comes from sprouts, soya, or milk and milk products. If she's a non-vegetarian, she can have egg, she can have chicken, everything subjected to condition that it is less spicy. Apart from all these things, she can have jeera, she can have oats, she can have barley, which help her to calm her body, as in the internal heat comes down, and this definitely helps in the good quality of milk production. Now, foods that help to increase milk production are methi, it is garlic, it is alsi, it is sometimes dry fruits. So having laddu, having a kheer, having paisam. Paisam is like a sweet dish which is generally in the south. So if you have all these things available, then definitely your milk production is not going to go down, and it will be at a same level that what you were having it before. So once you start having all these things, then definitely you will understand that anything up, whatever you delete from your diet, is going to cause a low milk supply. Second thing is that you are in a hurry, like after 1 to 1.5 months, you want to get back to a routine, you want to get back to work, possibility you have to look after another child also. So उस दौरान ये सब जब चीजें हम लोग देखते हैं, तो हमारा मिल्क सप्लाई डेफिनेटली हैम्पर होता है, हमारा स्ट्रेस बढ़ सकता है, हमारी नींद पूरी नहीं हो रही है, हमारा चिड़चिड़ापन बढ़ रहा है, इसके कारण भी मिल्क सप्लाई हैम्पर होता है. तो हमको ऐसी चीजें करनी चाहिए जहाँ पे स्ट्रेस बहुत कम हो जाए, और हमारा ध्यान हमारे बच्चे के अलावा खुद पे होना चाहिए, जो जो 90% माएँ नहीं कर पाती हैं. तो इसलिए मेरा यही कहना है कि जब आप फीडिंग करोगी, तो अपना मन और अपना ध्यान बच्चे की ओर अगर ज़्यादा बढ़ा दिया, तो वो बेहतर रहेगा, जिसके कारण कि फीडिंग का क्वांटिटी भी बढ़ सकता है, और फीडिंग का प्रोसेस में, रात के फीडिंग में जब डिफ़िकल्टी आती है, तभी भी चीज़ें बढ़ सकती है. अभी और एक सवाल आया है कि मैम हमारा फीडिंग दिन में अच्छा रहता है, लेकिन रात को फीडिंग जो है वो कम हो जाता है, अब इसके लिए क्या उपाय देंगे? ये हम लोगों को ऐसा सोचना है कि रात का जो फीडिंग है वो हमेशा कम रहेगा, क्योंकि दिन में बच्चे ने ऑलरेडी 6 to 8 टाइम्स ले चुका है। अभी रात के वक्त प्रोबेबली उसको ऐसा लगता होगा कि ये सब चीजें जो है वो सोते हुए उनकी जब एक्टिविटी कम हो जाती है, तब तब फीडिंग कम हो जाता है। आपका रात का खाना अगर प्रॉपरली नहीं रहा है, तब ये फीडिंग का प्रॉब्लम आ सकता है। या रात के वक्त बच्चा ज्यादा एक्टिव है और उसको हर घंटे फीडिंग चाहिए, तब आपको क्या करना चाहिए? तब आपको आपके बेड के पास एक ग्लास दूध, कुछ लड्डू, कुछ स्नैक्स, ड्राई स्नैक्स, मैं फ्राइड आइटम्स नहीं बोलूंगी, मैं प्रोसेस आइटम्स नहीं बोलूंगी, कुछ घर के बनाए स्नैक्स आप रख सकते हो। आप आपके पार्टनर की हेल्प ले सकते हो, या पार्टनर यानी आपके पति हो सकते हैं, या माँ हो सकती है, या आपकी सास भी हो सकती है, या कोई भी हो जो आपके साथ सोता है और वो आपको मदद करता है, जिसके कारण आपको ये जानकर बेहतर होगा कि जब आपको रेस्ट मिलती है और आपका बच्चा किसी और के साथ रहता है, आपको सुकून की नींद मिलती है, चाहे वो 1 घंटे की हो या 2 घंटे की हो। उसके कारण आपका जो मिल्क सप्लाई है वो रूटीन में आ जाता है, और रात को आपको दिक्कत नहीं हो पाएगी आपको आपके बच्चे को फीडिंग करवाने में। ये एक साइकोलॉजिकल साइकिल होता है, जिसके कारण हम लोगों को ध्यान देना पड़ता है कि सब चीजें एक साथ स्मूथली होती जाए। लास्ट में एक ऐसा हो सकता है कि हम लोग बच्चे को बॉटल दे रहे हैं और बच्चे को कंफ्यूजन हो रहा है निप्पल पे, बॉटल की निप्पल और ब्रेस्ट के निप्पल पे, इसके कारण भी फीडिंग पे इफेक्ट होता है। ये कैसे, मैं आपको बता सकती हूँ कि यहाँ पे हम लोगों को ये ध्यान देना है कि जब बच्चा ब्रेस्ट में फीडिंग करता है, तो उसका एक प्रोसेस जो है वो स्लो रहता है, कि वो सकलिंग करता है, फिर रुकता है और फिर लेता है। लेकिन जब हम बॉटल का इस्तेमाल करते हैं, बच्चे को आदत बन जाती है कि एकदम जल्दी जल्दी पीने में। परंतु यहाँ पे एक दिक्कत होती है कि उसके गले में चीजें अटक सकती है, जिसके कारण ज्यादा से ज्यादा हवा जा सकती है और बच्चा भूखा रह सकता है। आपको लगता होगा कि बच्चे का फीडिंग प्रॉपरली हो रहा है, परंतु नहीं, ये बच्चे का फीडिंग नहीं है, ये बच्चे को हवा जा रहा है। इसके कारण भी यहाँ पे लो मिल्क सप्लाई होने के कारण बच्चा हमेशा रोता रहेगा, चिड़चिड़ा हो जाएगा, या तो फिर उसका वजन बढ़ेगा नहीं। ये बहुत ज्यादा महत्वपूर्ण है। हम लोग कैसे समझ सकते हैं कि बच्चे का वजन बराबर है या लो मिल्क सप्लाई कैसा है? So for this, there is a very beautiful solution. To understand that the baby's weight is proper, the routine is proper, and there is no low milk supply, the weight has to be consistently checked after 15 days. If the weight is growth is going in the upward direction, then there is no low milk supply in your body. But if the weight is not growing, then definitely there has been low milk supply, because of which the weight of the baby is not grown. One thing. Second thing, the count of the urine has to be more than 6 times a day. So the diapers have to be wet and they have to be changed whenever there is wet diaper. Now, during the urine, when you see the urine, it has to be white in color or slight transparent in color. If it is yellow, that means it is a concentrated urine and the baby is having low levels of water in his milk, whichever it is taking. That means the mother is having less amount of water, and because of which the baby is getting affected. Third thing you have to understand is that when the baby is passing any motion, the baby is not, making sounds, or it is very difficult for the baby to pass a motion. Sometimes even blood can come out. This is not a sign of danger, but it is a sign to look out that the mother is having less amount of specific nutrients which is hampering the baby's growth and the baby's overall health. So I believe that if you concentrate on all these 3 points, that is the diaper change, that is the motion, and also the quantity of the milk, you will understand, because of the quantity, the growth has to be proper, the weight has to be proper. And these all things are definitely going to help the child for a steady growth, which will have no impact on the weight, and the weight graph will be going in the upward direction. Once we achieve the weight graph in the upward direction, it does help us understand that low milk supply has been ruled out, and the mother is taking good care of the child. One question has just come, that what happens after 6 months when we start with complementary food? I must congratulate the user that this is a very thoughtful question, because over here we have to understand that breastfeeding, when we are done with 6 months, the quantity of breast milk starts reducing as we are introducing complementary foods, or what we say as outside foods. Over here we can see that, when we are giving when we are giving rice, when we are giving dal, when we are giving small food, cooked foods, the interest of eating of the child changes. And as the interest of the child changes, it so happens that this child is not willing to go to have breast milk, or the breast milk may have a different taste. So definitely, over a period of time, from the sixth, seventh month, eighth month, ninth month, there is a low milk supply which gets initiated. Now the mother is also become very active. Even she has recovered from her birth of her child. She is taking care of herself. So at a given point of time, the milk supply does get hampered. But according to the WHO guidelines, it is very well projected that if a child is given milk, that is breast milk, till the age of 2 years, along with some good foods that the mother is planning for the child, definitely the child's growth is going to be much better. So if you are a mother, or if you are an expecting mother, I always believe that if you make a promise to yourself that I am going to breastfeed my child till the age of 2 years, you will be making your child's health for the first 5 to 6 years, and you need not be worried because the child will not be falling sick very often. Mothers get scared that I am going to breastfeed my child for 2 years. What is going to happen? Believe me, it is a joy to breastfeed your child, because your emotions, your feelings are all getting transferred to the child. They find it very secure, and the child is very very healthy and very very happy. It is not that the child is very demanding. It is the child is only requiring some protection, some emotional support, which we are able to give through breast milk. So, to summarize for this session of low milk supply, we can understand that we can concentrate on our diet, on our eating patterns, on the way we are able to, put the child to breastfeed after birth immediately. These are the things, if we concentrate, our milk supply will not go down. Secondly, if our diet is hampered, if we are in stress, or if the breastfeeding process has been delayed, we can still put our child onto breastfeeding, and we can improve the quality of milk. And third thing, we have to understand that when we are introducing complementary foods after 6 months, we also ensure that we do not stop breastfeeding, and we also take care of ourselves and the kid at the same time, so that we are able to continue breastfeeding till the age of 2 years. So, for more tips and more live chats, please follow me on Baby Chakra. I am here to answer your questions in regards to nutrition and lactation, and definitely I'll be helping out you all if you have anything in particular on Baby Chakra. Thank you, and please join us for our next live session, that is on Thursday.